PCOS, or polycystic ovary syndrome, is a tricky diagnosis that unfortunately affects a lot of our patients. Somewhere between 6 to 10% of the reproductive age population may be impacted by this condition. And its name is a bit of a misnomer. The word cyst or cystic often alludes to a problem within the ovaries, but in fact, the word cyst simply means a fluid-filled sac, and we know that part of this condition is having a really high egg number. That is in part how it gets its name, because women with polycystic ovary syndrome typically have a lot higher egg count or quantity of eggs than other women their same age. But PCOS is interesting in that we don't yet understand completely how or why it occurs or who it impacts directly. And then similarly, we don't have a single test to diagnose it. This is different from other conditions in medicine where you can take a single blood test and know if you do or do not have the condition. Unfortunately, this is also why polycystic ovary syndrome is really difficult to diagnose and is often a delayed finding for many patients, and they've sadly had to see many providers sometimes before this diagnosis is awarded. You have to meet 2 out of 3 conditions in order to, quote, be diagnosed with this. Those conditions are, in loose terms, high ovarian reserve or egg count that is above what we would expect. Additionally, the cornerstone to this diagnosis, and probably the one that most people identify with when they are seeking treatment for this, is irregular ovulations. For some women is an extension of their regular period by 5 to 10 days beyond what their normal cycle length would be. Other women may skip periods for almost an entire year. The third criterion is evidence of excess testosterone production or androgens. This can be in laboratory form or it can be in clinical signs. Some of those could include extra hair growth more than you would expect. Chin, upper lip, inner thigh are common locations for women affected by this, or even male pattern baldness, hair thinning on the top of the head. Or also commonly reported symptoms are acne or significant issues with weight gain or inability to lose. Although polycystic ovary syndrome is poorly understood as to why it happens, we know there may be some in-way genetic relation, but also potentially autoimmune conditions that may have some overlap. We really do not know at the core why this in particular occurs. That all being said, the specialists here at Heartland Center for Reproductive Medicine are all trained in diagnosing and treating this condition. We are experts in helping you identify if this is a condition you're impacted by. Important treatment cornerstones are protecting the lining of your uterus. If you are not currently seeking pregnancy or more suffering infertility, but just simply have irregular periods, long term, that can put you at increased risk of conditions related to your uterus, and therefore it's really important to be meeting with a physician who can help you either experience regular periods or ensure that you're protecting the lining of your uterus through medication. Up to about 85% of patients impacted by PCOS will respond, and by respond I mean have an ovulation form in response to an oral medication that we use very commonly. The first line treatment recommendation for this condition is actually letrozole or Femara, which, like I mentioned, is an oral medication. Unfortunately, many patients assume that all treatments through an infertility office are going to involve injections or be incredibly costly, but this condition in particular is one that often has a much simpler treatment to start. However, there are still a significant number of patients that may not respond or ovulate in after taking those medications. And for those patients, we often are talking about stronger therapies like injection medications or even in vitro fertilization.